My name is Sandy Turner. I'm a nurse practitioner, family nurse practitioner. I have been the director and major provider in this clinic since 2000. I was teaching at the Medical College of Georgia then and brought students out here to do a community assessment. We found that there were 3 issues that the students felt were of need. One was health care. There was no health care in the area at all. And the other was there was a need for adult literacy program. And then the third was a railroad crossing gate. And we finally got a railroad crossing gate a couple years ago. The church started adult literacy program in their men's group, and I started the clinic back in 2000. And at the time we were in the school, elementary school, but the principal was a member of the Deering Baptist Church, which was right across the street. So we started in the basement there. We worked in the basement for about 4 years, and at the time they had this house that was donated to them, and they said if we could fix it up, we could move here. When we first opened, we were open from 1 until 5, and so when we get here and the front porch would be filled with patients waiting, so we decided to move it to 12 and get those early people. Deering is a small community. It has about 600 people. Even though Deering has 600 residents, we have over 1,000 active charts that we see. So while all of our patients don't come from Deering, and not all Deering patients come here, we do serve a wide variety of patients from all over the area. When the students did their community assessment, what they found was the average income level for a family of 4 was about $6,000 a year. And for the most part, the patients that have been coming here since have been meeting that income level. We don't really ask them on a regular basis, but for the most part, they are uninsured, and many or most do not work at all or trying to get on disability and have very limited income. There's a large population, large community of Hispanic workers who work in the McCorkle nursery and also the lumber yard. Then the rest of the community, we see probably 60% is Caucasian and 40% Black. So, and most of our population is from about 45 to 65 years old. Usually you would think that a lot of our people would start going to private doctors when they reach Medicare age, but a lot of our patients are on multiple medications and can't really afford the copay of all their medication. The bulk of our patients come in for problems with blood pressure, diabetes, respiratory problems, COPD. What I'd like to do more than anything is to sit and talk and understand what their fears. A lot of times patients will have fears that they don't even want to verbalize in a normal clinic setting.
Well, talking directly with her patients is what really motivated me to nominate her, because you sit down with them and you talk to them and you just can't help but, fight back tears when you hear about their struggles in trying to access health care and the importance of the care that she provides to that community. So it's really critical. And the fact that she's a volunteer, the fact that all of the other staff people at that clinic are volunteers and that they're doing it out of the goodness of their heart and because they see a real need in their community.
We've never really charged and never needed to charge because if you don't have a billing section in your operation, it's not real expensive to run a clinic. At the most, we've had sometimes 10 volunteers at a time. We have 2 people checking in the front room and that they can sit and talk to patients that are waiting. We have 2 people that are doing blood pressures, vital signs, and a person doing the scribing, putting the records in the internet, and then we have one person that checks out medications so that we can keep track of our medications. We get our medications donated. All of the staff donates their time. So we finally have been able to afford some lab services, and the lab services cost about $10 per test that we run. The clinic volunteers have come and gone through the years, and I seem to wear out volunteers after about 5 years. And right now, half of the volunteers come from my church, which is Our Savior Episcopal Church in Martinez, and half from the Deering Baptist Church, as well as medical students, as well as nurse practitioner students, as well as community health students. And you know, you just get one patient that says, we really appreciate what you do, or you see that you're able to help a person understand that they can get control of their diabetes or their hypertension, or they can stop smoking. You just see that it doesn't take a whole lot to make a difference to help people.